Hello everyone, I am Dr. Mallika Shetty, Additional Professor in the Department of Prosthodontics, Yenepoya Dental College. I will be talking about minor connectors. Now, the specific learning objectives, that is at the end of this session, you will know what is a minor connector. You will be able to identify the different types of minor connectors for a given cast partial denture design. You will acquire the knowledge of design aspects of the specific minor connectors to ensure patient comfort. Let's see the contents. Introduction, definition, functions of minor connector, basic principles of design of a minor connector, types of minor connectors, tissue stops and finish lines, and I'll give you the references. I would like to introduce this topic saying that we bond with one another, with our family members. We support one another because we know that these are the key elements to build strong family connections. Now, in the same way, the topic today, the minor connector, is the key element which has one-to-one connection with the components, and thus it keeps the entire CPD together, and they support one another and they share the occlusal forces which comes their way, thus sustaining and increasing the longevity of the prosthesis. So, the definition of minor connector is, it can be defined as the connecting link between the major connector or the base of a removable partial denture to the other units of the prosthesis, such as the clasp assembly, the indirect retainer, the rests, etc. Now, let us take a closer look. Minor connector here, which is connecting link to the major connector and to the other components of the cast partial denture. The minor connector here again. Another closer look at the minor connector, which connects, it's a connecting link to the major connector and to the other components. Now, let's know the functions of a minor connector. The primary function of a minor connector is that it distributes the stresses that occur against certain components of the partial denture to the other components, thus preventing any buildup of force at a single point. It distributes the forces on the edentulous ridge to the ridge and the remaining teeth. Another function is that the occlusal forces on the minor connector that attaches the denture base to the major connector is passed to the minor connector that serves as an attachment for clasps, rests or indirect retainers. Now, this broad distribution of force prevents any one tooth or one portion of the edentulous ridge from bearing a destructive amount of stress. What are the basic principles of design of a minor connector? Now, the minor connector should have sufficient bulk to be rigid. Now, this need is emphasized because the minor connector distributes the stresses that occur against certain component of the partial denture to the other components. That is why it should have sufficient bulk. Now, second principle is that when contacting an axial surface, it should not be located on a convex surface, but instead it should be located in an embrasure where it will be least noticeable to the tongue. Now, the third would be, it should be thickest towards the lingual surface, tapering towards the contact area. It should form a right angle with the major connector so that the gingival crossing is abrupt and covers as little gingival tissue as possible. The sharp angles should be avoided and spaces should not exist for trapping of food debris. Now, let us look at the different types of minor connector. The first one is the one which joins the clasp assembly to the major connector. The second one is that which joins the indirect retainer and the auxiliary rest to the major connector. Third one is that which joins the denture base to the major connector. Fourth one is that which serves as an approach arm for a vertical projection or a bar type of clasp. Now, let us look at each one of them closely. The first one is a minor connector which joins the clasp assembly to the major connector. Now, it should be rigid because they should support the active component of the partial denture, that is the retentive clasp. It should be rigid because they should also support the component of the prosthesis that prevent the vertical movement towards the tissue. When contacting an axial surface, it should not be located in the convex surface, but instead it should be located in an embrasure area where it will be least noticeable to the tongue. They must have sufficient bulk to ensure the rigidity, but the bulk must be concealed or else it will irritate the tongue. Now, let us look at the configuration of the minor connector. The minor connector should be broad buccolingually, but it should be thin mesiodistally. This is to help arrange the artificial teeth in a more natural position. Coming to the second type of minor connector that joins the indirect retainer or auxiliary rest to the major connector. Now it should form a right angle with the major connector. Why? But though it forms that right angle, the junction should be a gentle curve rather than a sharp angular connection. It should lie in the embrasure between the two teeth to disguise its bulk as much as possible. Coming to the third type of minor connector that joins the denture base to the major connector. There are three types. The first one is a lattice work construction or open construction. Second one is a mesh construction, and third one is a bead, wire or nail head construction. The lattice work construction looks like this. The mesh construction is this way, and the bead wire or nail head construction is this way. What are the requirements of these minor connectors? They must be strong enough to anchor the denture base securely. They must be rigid enough to resist breakage or flexing. They must interfere as little as possible with the arrangement of artificial teeth. Now to see its coverage, in the maxillary arch, the distal extension case minor connector extension, you can see it extends the entire length of the residual ridge up to the maxillary tuberosity. In the mandibular arch, the distal extension case, the minor connector must extend 2/3 the length of the edentulous ridge. Now such a design in the mandibular arch is because this design will not only add strength to the denture base, but also it may minimize distortion of the cured base from its inherent strains caused by processing. Now let's take a closer look at each one of the minor connectors here. Open lattice construction. Now can you see this here? The open lattice construction, it is extended up to the ridge, and whenever there is multiple teeth to be replaced, we choose open lattice construction. It consists of two struts of metal, usually 12 to 16 gauge thick. It is extending longitudinally along the edentulous ridge. The smallest struts that you can see here, it's usually 16 gauge thick, and it connects the two struts and they form the lattice work. These connecting struts run over the crest of the ridge, and they cross the cross strut that should be between each of the teeth to be replaced. Now in the mandibular arch, one strut should be positioned buccal to the crest of the ridge and another lingual to the crest of the ridge. In the maxillary arch, one strut should be positioned buccal to the crest of the ridge and the border of the major connector acts as a second strut. Next most important thing that you need to see is that it is necessary to provide relief space over the edentulous ridge so that there will be space between the strut and the overlying ridge. It is in this space that the acrylic denture base will be formed. The relief space is provided by placing the wax form of the strut on the refractory cast and duplicating the master cast. The advantage of this kind of construction is that it provides the strongest attachment of the acrylic resin denture base to the removable partial denture. It is easy to reline if necessary because of the ridge resorption. We all know that in the distal extension case especially, there is ridge resorption that happens. So in such a construction, we can easily reline it. Next, coming to the mesh construction. Here you can see the mesh construction. This mesh type of minor connector consists of a thin sheet of metal with multiple small holes that extend over the crest of the residual ridge like the lattice work minor connector. Like the lattice work, this is also indicated with the multiple teeth to be replaced. But the main drawback in this type of construction is that it is more difficult to place acrylic resin dough because more pressure is needed against the resin to force it through the small holes. It also does not provide as strong an attachment for the acrylic denture base as compared to the lattice work. Coming to the third type of minor connector with the denture base, it is the bead, wire or nail head retention minor connector. It is used with a metal denture base which is cast to fit directly against the edentulous ridge. That is, no relief is provided beneath the minor connector. Now this form of minor connector is most hygienic because of the better soft tissue response to metal than acrylic resin. The denture base here is attached to the outer or the superior surface of the metal base, and retention is gained by the projections of these metal on the surface. These projections may be in the form of beads, wires or nail heads. Okay. These projections are made by placing beads of acrylic resin polymers on the wax denture base, then they are invested and then burnout is done and casting is done in order to achieve this. Where is it indicated? It is indicated on tooth supported well healed ridges when interart space is limited and the acrylic resin by itself would not have sufficient strength to withstand the forces of occlusion. What are the shortcomings of this kind of construction is that it is difficult to adjust the metal base. It cannot be relined adequately in case of rich resorption. It is the weakest attachment of the three types. Now, having finished with the different types of minor connectors, let's go further with the tissue stop. Now, the tissue stop is used on all distal extension partial dentures using lattice or mesh retention. It is in order to stabilize the framework during packing and processing. Tissue stop here. The tissue stop is made by removing approximately 2 square millimeter of wax used to create space beneath the lattice work or mesh. Then this depression is waxed as a projection of the lattice work or mesh. After it is casted, this projection will contact the ridge of the cast and prevent the framework from being distorted during the acrylic resin packing procedure. The tissue stop is made from the point where the posterior end of the minor connector crosses the center of the ridge. So, it should cross the center of the ridge and it is at the posterior end of the minor connector. We can take a closer look how the tissue stop is fabricated. Here we can see 2 square millimeter on the wax and then we cast it. Now, after having known what is a tissue stop, let us know the finish lines. Now, the finish line is that to avoid fracture, the acrylic resin must be joined to the major connector with sufficient bulk, because acrylic resin cannot be finished to a thin edge. If attempted, it will chip and fracture, creating an unhygienic and potentially irritating situation. The acrylic resin around the lattice work or mesh work minor connector must join the major connector in a smooth, even joint, because any irregularity between the two surfaces will irritate the tongue or the mucosa of the ridge. There are two types of finish lines. One is the internal finish line, the other one is the external finish line. The internal finish line is located on the tissue surface of the removable partial denture, the cast partial denture. It is formed during the blockout and relief step of constructing the framework. The external finish line is located on the polished surface of the cast partial denture and it is formed during the wax up of the pattern for the framework on the refractory cast. Now, coming to the fourth type of minor connector that serves as an approach arm for vertical projection or bar type of clasp, this is the fourth type of minor connector. Here we can see that the approach arm for the vertical projection or bar type of clasp is only the minor connector that is not required to be rigid. Otherwise, all the three previous minor connectors we addressed were supposed to be rigid. This type of minor connector, it supports a direct retainer that engages an undercut on a tooth from below rather than from above. It approaches the tooth from the gingival margin. It should have a smooth, even taper from its origin to its terminus. So, these were the four types of minor connectors. And so far we know about the different types of different types of minor connectors. We learned about the tissue stops, we learned about the finish lines, the basic designs that is required to construct them. These are the references. There are many more references, but these are the two what I have referred. Thank you.